Hey, so this is my friend Victor Longa. He volunteered to do this diagnostic interview. Hello, Victor. How are you doing?
I'm fine. Everything's going fine.
That's good. That's good. I'm gonna do an interview. It's basically a diagnostic interview. I'm gonna ask you a couple of questions. It's gonna involve mental and physical history, and
Hmm.
basic simple questions. So, I just want you to answer truly, and it's gonna be easy and simple task. Okay?
All right. Sounds good.
So I'm gonna start by asking, who suggested that you should come to see me? If you did anyone ask you that you should go to therapy to see me, especially, or you just wanted to see me just by a chance?
No, really. I guess just because dealing with the stress for school, I kind of just like figure, it will
Mhm.
be better or best to talk to somebody about it. I don't know.
I understand. I understand. That's good. That's good. Okay. So what are you hoping to work on specifically? Is there something specific or like something that you want to prioritize? Like, for example, an issue that you would like to work on?
I would like to control my stress levels
Okay.
a little bit more
Okay.
because sometimes I feel like uh, going through school, soccer, work, and everything gets me really clogged up with like stress and everything.
Okay.
Sometimes I feel like I don't know. I feel weird.
I understand. I understand. If you do you have any specific symptoms regarding these stressors?
Some anxiety sometimes.
Okay, anxiety.
Yeah.
Do you feel sometimes low or do you have low mood?
Sometimes. So every time that I stress, that's why like I want to control my stress levels. I want to go to smoke to kind of like calm down my mind and everything. I
Hmm.
know that long run, I know it's not good for my health. So I
Okay.
want to try to change that.
Hmm. So, what are the stressors in your life currently exactly? Like you mentioned soccer, like a lot of sometimes training, and also
Yeah, I will say a little bit stressed for soccer because next semester will be my last semester playing soccer, and I don't know how my life is gonna go after soccer because I played entirely my life, and then I'm almost graduating, and over the summer I'm gonna be doing my internship and studying for my DAT test for dental school.
so
So that's stressful a lot already.
so the future and the
That future,
ambiguity of
pretty
this
much.
future sometimes
Hmm.
stress you out. Okay. What do you, it's just a simple question. What do you think is something important to know about you specifically? Just one thing.
Mm, can you
Could
give me
be
an
anything.
example?
Could
Like,
be anything. Like I, I'm as a person, I like to play soccer. This is something that represent me or something.
I will say, as a person, I'm really friendly.
Okay. Okay, that's good. That's good. Now I'm gonna move on to talk about ask questions about mental and physical health history.
All right.
So my first question would be, do you have any prior mental health history?
No, any.
Okay. So you're not given any treatment or diagnosis by any doctor or therapist or
No,
psychologist before. Okay.
not
Were
at all.
you ever hospitalized before?
The only thing for my knee injury, but that was it.
Okay. Do you remember when was that?
Last year,
Okay.
around this time.
Okay. So it's nothing serious about the mental, like,
No, not
okay.
really.
Okay. It was just a physical knee injury that you were like basically treated on through a
Hmm.
surgery, right?
Yeah, that's right.
And that helped you to, the surgery helped you recover, and maybe you went back to soccer and did good there.
Oh yeah, definitely. Yeah, it did
Awesome.
work.
Awesome. Okay. Is there any current or previous thoughts of you hurting yourself?
No, not at all.
Okay, good.
Never.
Is there any thoughts about hurting someone else, maybe?
When they get me really mad sometimes,
Okay.
but usual.
Could you further explain that?
I will say if somebody really pisses me off, kinda,
Hmm.
I just sometimes it's really hard to control myself, and
Hmm.
I always do,
Hmm.
but you never know what can happen if I don't control myself, you know?
Okay. Okay. I understand. I understand. Sometimes anger is hard to control.
Yeah, it is.
Do you have any family members that suffer from a mental illness or have a history of mental illness issues?
No, not really.
Okay. All right. Now I'm gonna talk about specifically your physical health history.
Hmm.
You don't have any current health problems.
No,
Okay. And when was the last time you had a physical examination?
I believe 4 months ago, because I play soccer, so they usually do like a physical examination before start playing. So yeah, it
Okay.
was like 4 months ago.
That's good. Keeping yourself checked physically is always something good. Okay. And I'm gonna move now to a different category. It's about substance use and if you abuse them at all. Do you have any concern regarding use of substance?
Maybe smoking nicotine, that would be one. And
Okay. Because
sometimes, yeah, as I mentioned before,
you
when I get,
mentioned sometimes when you get stressed, you
yeah,
want to get the nicotine rush to make you control the situation to an extent.
mhm,
That's correct?
that's correct.
Okay. Okay.
And I will say alcohol, but I really stopped drinking alcohol long time ago. So my big thing right now is just nicotine.
Okay. That's good. Thank you for letting me know. Okay. Is there anyone in your family that use any substances for any reason?
My dad just drinks. Pretty much my
Okay.
entire family from back home, they drink a lot, and they smoke also. But
Okay.
that's it.
Hmm. Now let's talk about the legal history. Did you have any past or current legal issues?
No, no at all. I'm cleaner.
That's good. That's good. Excellent. Let me now talk about your history of your childhood. Have you previously, like maybe you received trauma during high school or like any kind of problems during childhood from your parents or anything?
Not really. My childhood back home was pretty good. Uh, Having friends. I wasn't bullied. Uh, sometimes when you get or you do something wrong, your parents like kind of like yell at you, but that was it. Like
Okay,
nothing far from that.
that's something normal. Okay.
Yeah, something normal.
Do you have also any past or present educational problems?
No,
Okay. Now let's talk about your social history. Do you have do you have friends and associate in your life?
yeah, I do. That's what I said. I'm really friendly.
You mentioned
I
that. That's
I
correct. Yeah.
get it's really easy for me to get to know somebody and become a friend or have more friendships.
Mhm.
I mean, that's just me.
Do you belong to any clubs or organizations or any certain activities in?
Well, soccer, I will say, is a kind of like a club. I mean, it's like
Yes.
an organization. And
Yes.
then I'm also part of the road track club on my school.
Okay. Okay.
So yeah, those two.
Okay. Now I'm gonna move up to a different category, asking you about your work and the history. Are you currently employed?
Well, I'm gonna go to my internship over the summer, but I was here at school working at the gym and as a tutor.
And were you satisfied with that work? And how are
Yeah,
you doing there? Okay.
satisfied. Yeah.
Okay. How would you describe your financial status right now?
Right now, I will say I'm fine. Like I don't have any big debts to pay off. Uh, my school is already paid off, and I got some money from some scholarships. So right now, I'm sitting in a good place with my financial stuff. So it's not really a worry for me right now.
Good. Good. Now I'm just gonna ask you some generalized questions. Uh, what do you want to change about yourself?
I will say that I really want to change is how or be able to control myself on certain type of situations,
Hmm.
like that's in like meaning like stressful situations, and knowing how to make that right choice or right decision being on pressure.
Okay.
Pressure.
So you want to understand how to control yourself in a stressful situations and
Yes.
how to make the right decisions, basically.
Mhm. Exactly.
Good. And what changes do you hope therapy can lead you to happen?
um just knowing more about myself and knowing
Mhm.
how to control myself and knowing how I can react and how can I control my reactions to other people.
So you think maybe through talking to a therapist that can help you
Yeah,
guide
definitely.
you through these situations? Okay.
Because sometimes, it's different talking to a friend than talking to somebody that knows what he's talking about
A
and he can
professional.
actually a
That's true.
professional.
That's true. Do you okay, are when are you happy? What are the positive factors in your life? Like when are you happy exactly? And what kind of positive factors that happen in your life when you are happy?
Like what gets me happy is
Yeah,
that the
basically, yes.
well, I'm happy every time that I'm hanging out with my really good friends, having a good time, or when I work really hard for something and I actually get to get a good grade or get an internship or a scholarship or something like that, or achieve my goals, I will say. Gets me
So
happy.
achievements sometimes can lead you to the happiness mode. That's correct. Okay. And just to at last, is there anything we haven't talked about that is relevant or important, or maybe you feel that I should know about you?
No, that's pretty much it.
Okay, awesome. Thank you so much for your time, and I hope this can help you. And I'm gonna try to refer you, or maybe even have a next session, and we can talk more about your problems, and I will try to guide you through everything as
Thanks a lot.
far as I can. Okay,
Thanks a lot. I
thank
appreciate it.
thank you so much.
Thank you.